Hey guys, it's Sarah. I need to catch you up on quite a bit of things. The triplets were born at 25 weeks and 1 day by emergency C-section. So I'm here to kind of catch you up on what has happened. I'm not going to catch you up on everything between my last vlog and today, because I just kind of wanted to let you guys know the status of everything right now before I go talking about all kinds of other things. So of course the babies are in the NICU, and I was discharged on Friday. So today is Monday. Today is probably the first day that I have felt pretty good walking around, you know, not needing a wheelchair. Hopefully once I feel like I have healed, I'll start seeing the babies for longer periods of time. The entire time that I was hospitalized, I would only see them for literally a few minutes a day because it was all I could handle. It took a lot out of me. They were at a different hospital, actually, than I was. So to get from where I was convalescing to the NICU, we had to cross from one hospital to another, and it was a series of like catwalks between buildings. And they're so small that they don't bother putting chairs for parents in the NICU because you can't hold them. So there's really no point in like having a recliner. You know, we're nowhere near the point of doing skin-to-skin contact right now. What prompted the emergency C-section is on Sunday, April 26th, my water broke. I had quit working the week before that, like the Wednesday before that. So I'd been kind of taking it easy. That particular day, I basically sat most of the day. Some wonderful friends on YouTube contacted me about creating an online baby shower. Specifically, Lisa Marie TTC, who is kind of like one of our guiding lights in the TTC community, encouraged me to do it and helped me, you know, go ahead and follow through with creating an Amazon baby registry. So Sunday I did that. I spent the day kind of finalizing creating an Amazon baby registry. So I will share a link to that registry in this video, and I still, although things have changed, I still plan to try to film an online shower on or around June 1st. So I'm hoping if I share it now, that gives everyone plenty of time to shower us with gifts if, you know, if you're so inclined. I don't expect anything from anyone, but it is very much appreciated. Any little thing now more than ever, just because I don't really have time to go through the nesting phase. I'm already in the mommy phase, and I can't think of a whole lot else right now except getting better and then being with them. So let's see. So then Sunday night I painted my nails. I know that sounds silly, but I hadn't done that in months upon months, and I was just getting into the whole relaxation thing. And then I cooked dinner. I made a recipe out of the multiples book that I showed months ago when I first found out I was pregnant, called When You're Expecting Twins, Triplets, or Quads. I made beef stroganoff out of that book, and I ate it late. like 8:30 p.m. because I failed the 1-hour glucose test the week before by a small margin. But regardless, on April 27th, I was supposed to get up extra early and go take the 3-hour glucose tolerance test so that I would be done with it by my 11 a.m. Growth scan. So I had a very late dinner. I ate around 8:30, and then at like 8:45, I know the time of everything, I asked my husband to scoot closer and lay his hand on my belly because I had been feeling a lot of activity from the triplets. And so, I was very relaxed, just reclining, and he was literally sitting next to me and put his hand on my belly, and my water broke. And I was in no pain. I felt no contractions or anything. I just felt a gush of fluid. And I'd been in the habit of wearing a pad just in case any, babies decided to kick my bladder, or sometimes you just have a little urine leakage when you're pregnant. So I filled that. I could tell that pad had filled to the max. And so went to the restroom. Husband followed me because he was concerned, and I urinated, and I said, what I'm doing right now is urine. What just happened was not. After I completely emptied my bladder, I could still hear fluid hitting the water in the toilet. And so I asked my husband for the magnet on the refrigerator that we had in case of emergency. I called the exchange line and told them that I was 25 weeks pregnant with triplets and that my water had broken. And the exchange line told me the doctor on call would be calling me back, and if I didn't hear anything within 30 minutes to call them again. But I wasn't going to wait for that. So as soon as I hung up, I put another pad on, stood up, and soaked that one as well. The fluid was completely clear. There was no sign of bleeding. I told my husband to just get ready, that we were going to leave before hearing back from the doctor because I didn't want to mess around, especially since I had Vasa Praevia and had already checked myself into pregnancy assessment once before, just for some brown spotting, which turned out to be nothing at the time. So I felt confident going. I knew how to get there. I'd already been there once. I told my husband, you need to pull my car into the garage and pull your car around front, and you will drive. So while he was doing all of that, the phone rang, and a doctor who was on call, I almost said their name, but I guess I'll try to keep things private. Doctor described to me again what happened, and she said, "Are you having any contractions?" And I said, "No." "Any bleeding?" "No." She said, "Okay, so the reason I'm asking is I'm trying to determine if you are stable enough to drive here immediately, because if you weren't stable, then I would ask you to go to the closest hospital and we would helicopter you over." So we got the clear to drive and we set out. I'll try to skip some details of how horrible that commute was. It just seemed like if something could slow us down, it did. But I'll just jump right to the part where I arrive at pregnancy assessment and repeat, Dr. So-and-so is expecting us. I'm 25 weeks pregnant with triplets. My water broke and I have Vasa Praevia. And she just said, "Whoop, turn right back around." She said, "I'm not even going to look at you. I'm just going to take you straight to labor and delivery." So she took us where we needed to go. And while we were commuting to the hospital, the doctor on call was assembling an emergency C-section team. She knew that given my Vasa Praevia, things could progress extremely quickly. And I don't know if I had ever told you, but should baby A's blood vessels rupture, there's like a 3-minute window to get that baby out. So it was a very serious situation. So when we arrived at our room, there was already a team ready to go, a surgical team. They asked me some questions just to verify that, you know, it was still believed that I have Vasa Praevia, but they said they would double check to make sure. Because the Vasa Praevia would influence all of their decisions from that point forward. So, first thing they did was an ultrasound, and they wanted to see all 3 heartbeats, and they were there. All 3 heart rates were doing just fine. I'm sorry if this is shaky, you guys. I'm holding a new tiny little camera. The next thing they wanted to do with the ultrasound is verify the Vasa Praevia, and they did. So the blood vessels for baby A were still going across my cervix. In the meantime, there was a nurse and an anesthesiologist putting an IV in each of my arms. And the reason is, when you have preterm labor, they typically will give you magnesium sulfate drip, and it cannot be mixed with some other fluids that they need to give you. So it's best to have 2 different ports ready to go. Sorry, I'm trying to make sure I say things in the right order. And obviously it was very scary, and it moved very quickly. All right, so the next was, let's see what my cervix was doing. And with Vasa Praevia, they cannot do a manual examination like they would for a regular pregnancy, where they would feel your cervix to determine how dilated you are. They had to do a visual exam. And the doctor estimated that I was 1 centimeter dilated at that time. So they didn't see any bleeding. They called the backup doctor on call, and it turned out to be one of the MFMs that I have seen multiple times on my regular visits. So now I had 2 MFMs in the room, 1 on call and her backup. I had an anesthesiologist, another doctor who was probably a fellow, several nurses and techs, and all these people are in the room surrounding my bed. And so my poor husband is trying to stay as far away as he can. So the backup doctor was a familiar face, and I really appreciated that. And she said, we had a choice at that point. She said, if you were only having 1 baby, I would just section you right now. Given that you have Vasa Praevia, and your cervix is dilated 1 centimeter, I would just take your baby right now. She said, but we have 2 other babies in there who are none the wiser. And all 3 of them are very small right now. So, given that there's no bleeding, we have the choice of doing a section right now or trying to get in 48 hours of a steroid. And it was my choice. So I said, given there's no bleeding, let's get the 48 hours of steroids going. So they gave me my first shot at 10 p.m. And the idea is that 24 hours later, they would give you another shot and then allow another 24 hours to go by for a total of 48. Research has shown that those 48 hours of steroids dramatically increase the development of your baby's lungs and therefore improve your baby's chances in the NICU. Then they told us to get some rest. I had a fetal monitor on all 3 babies, and I had a monitor on my heart. And I had the magnesium sulfate drip going, which they told me might make me feel like I had the flu. And I didn't really notice that it made me feel sick. Long story short, I wasn't really on it long enough to maybe feel those side effects. Around 12:30 a.m., they had some neonatologists come in and explain to us what to expect with 25-week preemies, what some of the risks were, and so on and so forth. So I appreciated their visit, and then they left and, told us again to try to get more rest. And so then between the hours of 3 a.m. and 4 a.m., I had noticed that the entire evening my contractions... Oh, I'm sorry, I was having contractions too. I just didn't feel them. Hi, husband. You can come in. I didn't realize at first that I was having contractions. I didn't feel them. They didn't feel painful. They weren't intense. It actually just felt like maybe a baby was moving. Because when my babies would move, they would push my belly out so far that I would feel like stretched and like a tightness. And it was just from them having so little space and trying to push me outward. So they were 8 to 10 minutes apart. And between the hours of 3 and 4, I couldn't help myself. I started noting the time whenever a contraction would come around. And I was listening to baby A's heart as well as my own. They turned the sound off on the other two. They were really only concerned with making sure baby A's heart rate didn't drop because his membranes had broken and he had the Vasa Praevia. Somehow I convinced myself that with every contraction his heart would stop, so I called them in and they said, nope, his heart rate's doing just fine and we can see all of your contractions on a monitor in the other room, so we know what's going on too. And I said, okay, all right. And then between the hours of 4 and 5 a.m., my contractions were 5 and 6 minutes apart, and I decided I'm not going to screw around with this, and I'm just going to call him back in. So around 5 a.m., I asked them to come in, and I said, I think my contractions are getting closer together. And they said, well, they really aren't, and we can see them. They're not getting more intense, but it would probably be prudent to do another visual check because the difference between Braxton Hicks contractions and regular contractions is what your cervix is doing. So they did another visual exam, and I was still only 1 centimeter dilated. However, the MFM said this time, or doctor said this time, that there was blood in the fluid. And when she removed the speculum, I could feel another gush of amniotic fluid. All right, what are you doing? Okay. The nurse, okay, so there are no stirrups on the bed, so in order to elevate me, what they do is they take a bedpan, they flip it upside down and slide it under your tailbone. So the bedpan, although it was upside down, it has like a lip around the outside, just enough to catch some fluid. And the doctor and the nurse went behind a curtain, and I heard the nurse say, "Did you want to look at this?" And I knew that they had to go converse with the MFM on call, or not on call, but the one that was on the floor that night. And so I thought to myself, that's it. I'm done. I know they're going to call it now that they've seen blood in the fluid. And I thought, when they get out there, I'm going to wake my husband up and I'm going to tell him that this is it. But the doctor must have been standing like right outside the door, because as soon as the nurse said, "Did you want to look at this?" like the lights to my room came on, and there was both doctors, my nurse, and the entire team that I had met earlier in the night. They all just came in. And around this point, it was probably 5:40 in the morning. And so my husband jumped up and ran, to the far side of the room again so that they could get to me. And I could only focus on the one doctor. And she explained, you haven't dilated anymore, but now that we've seen blood in your fluid, we're done. I have zero tolerance for seeing blood when you have Vasa Praevia. So it is time to take the babies. So I had been so really calm the whole time. I was almost eerily calm. I was really strong. But when she said that, then I started to cry. The OR room was only 2 doors down the hall, so there was no time at all. So as she's telling me this, people are unplugging all of my machines, and some are throwing things on my bed, cords, and unlocking my wheels on my bed and getting me all wrapped up into this little mobile capsule, basically, and they start to wheel me out the hall as she's still talking. So I think she might have even talked to me all the way down the hall, but I don't remember. They kind of ran with me, and we got to the OR room. I've kind of... I can't really talk about that part too well. It was something out of a movie. There was a team for each baby, and there was a team for me. I probably at this point can't really go into detail about things that I heard and things that I felt, just because that experience was very short, but was probably the worst experience of my life. But because of the emergent, situation, they wanted to do general anesthesia. They had no time to bother with, epidurals and things like that. So I was completely put out, and so my husband could not be in the room. And we had discussed all of this ahead of time, throughout my stay, arriving at, 9:30 p.m. or whatever. We knew that this would be the way they would do it if they saw blood. So everything was expected from my point of view. Let's see. So I wake up, and not gonna lie, that is very painful. When you wake up, you're not on pain medicine, you just are coming out of anesthesia. So when I woke up, I was feeling in real time what you would feel after just having surgery. So I was not a happy girl. And they wheeled me back to my recovery room, and almost immediately I was given one of those units where you've got the button that you can press every 10 minutes for morphine. I think they had to wait until I was responding, able to identify myself and things like that before they would give me control over my own morphine. But once they did, oh my goodness, I pressed it at least every 10 minutes. See, my mom was in the room when I came to, and My husband was not, and that's because he went with the babies, which is how I arranged everything ahead of time. So then when my husband arrived, I was very groggy, and I could hear my mom asking him questions, and I remember it made me so mad because nobody was going to find out about my babies before me, not even my mom. So I hope that she understood, but I asked her to leave. I just wanted to be with my husband alone for a little while. And he showed me pictures of the babes, and I made him show me several times while I was in that room. I was in that room for like 6 hours. It felt like maybe an hour because apparently I would wake up and talk and then pass out again. Okay, so the babies, they were delivered in order. So from lowest in my abdomen to highest. So baby A was born first. They all cried, by the way. That was a really good sign for their age, 25 weeks in one day. They all made some sort of cry. Baby A is named Caelan James, and he weighed 1 pound 6 ounces, and he was 12 inches long. They did have to do like 2.5 minutes of chest compressions on him, so he did not have a good start, but he is, you know, he's no worse off than the other two. Next was baby B, and his name is Connor Thomas, and he weighed 1 pound 5.2 ounces, and he was 12.5 inches long. And if you'll recall, he's the one that I think I might have told you, maybe not. He had a little bit of resistance in his umbilical cord, so they were predicting that he might be the smallest. So by a little bit. And then baby C, the girl, was born last, and her name is Maeve Lynn, and she weighed 1 pound 6 ounce and was 12.5 inches long. So, oh, my light bulb's going out. So they were basically on par with each other as far as their sizes go. Everything changes every day with them. I have started a Caring Bridge site for them where I'll post updates from time to time. It's as much to keep people informed as it is an outlet for myself, because I will be there as much as I can, especially as I start to feel better. I can't think. That's my medicine reminder. Is that not the cutest thing? I can't thank all of you enough for all of your prayers, because I really believe that they work. And I want to thank you for being patient through my pregnancy, because it was hard, and it seemed like I was always learning something a little concerning, and I didn't necessarily want to jump on and vlog about it. And I think that's how it will continue to be. But I will still check in, because I don't want to let you guys down. I don't want to disappear. And I want to stay an active part of this community. So thanks for watching. I'll put links below for my online baby shower and for the Caring Bridge site that I've got set up. I haven't really posted anything there yet, just so you know. But I will see you all again soon. Thanks for everything. Bye.